no va a ser perfecto. No comprendo mucho. Perdón. Yo hablo poquito español. Hello, I'm Lauren Kuhn, and I'm a dental student at Harvard.
Hola, mi nombre es Irlanda, soy una asistente dental de Lynn Community Health Center.
So Irlanda has been the most wonderful assistant here at the Lynn Community Health Center, and when I came here, I knew basically no Spanish, but at least half of the patients speak only Spanish. So I thought that we would make this video together, along with our friend Henry, who you'll meet soon, to help anybody who's coming here to learn a little bit of dental Spanish.
Hola, buenas tardes, ¿cómo estás, Manuel? Bien, le vamos a hacer hoy un procedimiento dental. Quiero que por favor firme este consentimiento para lo que le vamos a hacer hoy. Hoy es un relleno, le va a ver la dentista, viene en un momento.
Hola Henry, ¿cómo estás?
Bien, bien, gracias. ¿Y usted?
Bien. So I said, hola Henry, to greet him, and then I said, ¿cómo estás? To ask him how he is. Mucho gusto. It's very nice to meet you. Me llamo Lorena. My name is Lorena. Su dentista hoy. Su dentista hoy means I am your dentist today. And then I'm going to tell him that today we're doing a filling. So I'm going to tell him that today we're doing a filling. Very basically, I would say, hoy relleno. Today filling. Or if we're doing 2, I can say dos rellenos, or 3, tres rellenos. Hoy, today. Por favor, please. Iniciales aquí, aquí, aquí. Firma aquí, por favor. Please initial here, here, here. And firma means signature, aquí, here. Gracias, señor.
Básicamente nosotros tratamos de a los pacientes de educarle para mejorar su salud dental. Le preguntamos preguntas básicas acerca del cepillado, del hilo dental, de usar fluoruro, los cuales son cosas muy importantes para mejorar la salud dental del paciente. Lorena le va a preguntar algunas de estas cosas.
So now I want to ask him about his habits. So I want to know if he brushes twice a day. ¿Está cepillándose 2 veces al día? So I said, ¿está cepillándose 2 veces al día? Do you brush twice a day? Now I want to find out if he flosses. ¿Está usando el hilo dental?
A veces.
Muy bien. So I said, very good. ¿Está usando el hilo dental? That means you floss every day.
Yes, and Henry dice that he is doing it sometimes. So we got to tell you, Henry, that you should use the dental floss every day, especially before you go to bed. You brush your teeth, you use the floss, and then you rinse your mouth after, and you go to the bed with clean mouth. It's very important because it's one of the ways to avoid diseases like, gum disease, periodontal problem, many problems, okay? And it's very important that you use the dental floss before you go to bed.
Exactly. So if somebody says that they're not using something or only using it sometimes, you can also say whatever it is, like el hilo dental es muy importante. So it's very important. And then I could say, debe usar el hilo dental. You should use dental floss. And I want to ask him if he's using a fluoride mouthwash. So I would say, ¿está usando enjuague bucal con fluoruro? No. Muy importante. Debe usar enjuague bucal. Le recomiendo ACT. So what I said to ask him if he uses a fluoride mouthwash is, ¿está usando enjuague bucal con fluoruro? And then I told him that it's very important and that he should use it. And then I recommended ACT mouthwash. Le recomiendo ACT.
¿Tiene algún problema de salud?
Sí.
¿Qué cosa tiene?
Alérgico a la penicilina.
Okay, so we just wanted to know if he had any medical problems or if he has any allergies. So Irlanda can ask these questions, which you have heard, or you could say something like problemas de salud, problems with your health, or you could say alérgico a medicamentos. Is that correct?
Sí, está correcto. Él es alérgico a la penicilina.
Okay. Alérgico a medicamento, penicilina, in this case. And then if you want to know if someone is taking medications, you can ask them, are you taking medication?
¿Está tomando algún medicamento?
Sí.
So medicamento is the word for medications in Spanish. So now we're ready to get going. We can sit the patient back.
Vamos a recostar el paciente.
And then we're going to give him some glasses. Los lentes son muy necesitas. Is that correct?
Los lentes son muy necesarios para el procedimiento, para evitar que caiga algún líquido en sus ojos.
Okay.
Okay. So, perdón, I'm sorry. I actually said something that was improper. So, I should say that the glasses, los lentes, son muy necesario. Is that correct?
Está correcto.
Necesario. They're necessary. So then you give them the glasses so that they protect their eyes. So if I want my patient to open, I can say abra. That means open. If you need them to open really big, abre grande. Abre grande. And then if you want him to bite, you say muerda. Is that correct, Yolanda?
Está correcto.
Okay. And if you want them to close but not necessarily bite, you would say cierra. Is that correct?
Está correcto.
Okay. And if you don't want them to close, you could say no cierra, por favor. Don't close, please. Also, if you want your patient to put their lips around the suction and close only their lips, you can say cierra la labia. Cierra la labia. That means close your lips.
Cierra los labios. Sí.
Oh, okay. Cierra los labios. Okay, cierra los labios. And then if you want them to put their tongue to the roof of their mouth, how do you say that?
Ponga la lengua en el paladar,
Okay.
por favor.
La lengua.
En el paladar.
Okay. So you want their tongue to go to the palate. Okay, so in the process of working on my patient Henry, I find that a cavity is very deep and I want to let the patient know. So in that case, I would say, hay una caries muy grande. And I can also point and say aquí, or touch the tooth. So I would say, hay una caries muy grande. That means the caries are very big. And in Spanish, the word for caries is the word for cavity. So that makes sense. And then, when I want to polish the filling, or if I'm polishing teeth in a cleaning, you would say, voy a pulir el relleno. That means I'm going to polish your filling. Or I could say, if I'm polishing the teeth, voy a pulir los dientes. Is that correct?
Está correcto, muy bien.
Wonderful. So I've learned a lot since I've been here. At the end of the appointment, we want to know if the filling is high. So I can take the suction out of the patient's mouth and then say, muerda, ¿cómo se siente? And that means close, bite your teeth together. How does it feel? Alto, normal?
Alto.
Alto. Okay, so alto means that it's high. Normal would mean that it's normal. So then I would put articulating paper in between his teeth, and I would say mastique, which means bite up and down, lado a lado, which means grind side to side. Sometimes patients don't understand this, so Orlando taught me to say rechine los dientes. Is that correct?
Yes, eso es correcto.
Okay, rechine los dientes, that means grind your teeth. A few other things you may want to know for your Spanish-speaking patient include how to ask them if they're okay. So if you want to ask them that, you can say, ¿Está bien? ¿Está bien means, you okay? So you can ask that as a question, and hopefully they will reply in the affirmative. Also, if you want your patient to not move their head, for example, if you're doing an extraction or something like that, you say, no mueva la cabeza. No mueva la cabeza. Por favor, preferably, so you say please, of course. Also, if you want them to relax their tongue, you can say relaja la lengua. Relaja la lengua. Relaja means relax, of course. The upper arch is arriba. The lower arch is abajo. So if you start hearing a patient say something about arriba or abajo, then you'll know if it's in the upper or the lower. Dolor is a word for hurting, and duele is also a word for pain. So if you're doing a procedure and you want to find out if your patient is having any pain, you can say, no duele, no duele. And if they say that they have duele or dolor, then you'll know that they are not feeling the anesthesia adequately. Also, if you're going to be doing something with a lot of pressure, such as an extraction or placing a wedge, you could tell the patient, mucho presión, like there will be much pressure, mucho presión. And if your patient tells you they have a medical problem and they have presión alta, that means high blood pressure, presión alta. So you can listen in for these little keywords. Another word that's useful is limpieza. Limpieza is a cleaning, so dental prophylaxis. So if you're doing a cleaning today, you just say, hoy limpieza. Está bien means it is okay. So if you tell your patient they have deep caries and that you're concerned they may need a root canal, but then everything is fine, then you say, está bien. Okay? Also, if you want to tell the patient that you're going to do a white filling, you could tell them that you're doing a relleno blanco. Relleno blanco. And when they come into the room for the first time and you want to welcome them, you say, bienvenido. Bienvenido. Also, many patients will come accompanied by their children, and a lot of these kids are just the cutest things you'll ever see. So a son would be niño, and a daughter is niña. Okay? And if you want to say, your son or daughter is cute, you could say, tu niño es muy bonito. So bonito for a boy, because this is a niño. And if you want to say your daughter is very cute, tu niña es muy bonita. Okay? And then when you finish your procedure, you could tell them that it was very nice to meet them, and you say, encantada. And usually they will reply and say gracias to thank you, and you can just say de nada, and then goodbye, adios.